A stage 4 cancer diagnosis does not automatically mean that every possible treatment option has been exhausted, but the next step depends on much more than the cancer stage alone. Hearing those words can fundamentally shift how you approach a really complex medical situation. When you're dealing with advanced disease, it is incredibly easy to feel totally overwhelmed by urgency and fear. It's completely understandable. But today, we're going to replace that panic with a structured, clear, and highly medical approach to figuring out exactly what comes next.
So let's dive right into this explainer and look at how modern oncology in Germany approaches advanced and metastatic cancer cases. We'll be looking at how one of the world's leading healthcare systems, which is really known for its academic depth and highly regulated, multidisciplinary care, evaluates cases where the stakes are, frankly, at their absolute highest.
To do that, we're going to walk through an exact, step-by-step patient pathway. We'll start by breaking down what stage 4 actually means, how strategies are personalized, the role of multidisciplinary reviews, and the actual logistics of getting to Germany with physician-led coordination. The goal here is to transform what feels like a chaotic, manageable process into a manageable, logical sequence. Let's start right at the foundation. What does a metastatic or stage 4 diagnosis actually mean in a modern clinical setting?
Well, there is a massive misconception out there that we really need to clear up right now. Stage 4 describes a broad category. It is not one uniform clinical situation. It just simply means the disease has spread from its original site to distant parts of the body. I want to make it absolutely clear that stage 4 lung cancer, breast cancer, prostate cancer, or colorectal cancer simply cannot all be treated the same way. A patient with one limited metastatic site might have a completely different treatment pathway from someone with widespread disease. Metastatic cancer is not a one-size-fits-all condition, and the treatment goals, whether that's slowing the disease, reducing symptoms, or preserving your quality of life, differ substantially based on the individual.
So knowing that, what's really interesting about this next phase is how German specialists actually go about building a strategy that is customized just for you. They do it by looking at the entire picture. Treatment decisions depend entirely on your exact clinical situation, not just the stage 4 label. To figure this out, doctors have to review a comprehensive list of factors. They need to see the precise pathology and biopsy results. They need the latest medical report and imaging, like your CT, MRI, or PET-CT scans, to understand the exact location of the metastases. They also have to look at previous treatments you've had, like surgery, chemo, or radiation, your recent lab results, and crucially, your current overall physical condition. But modern oncology actually goes way deeper than just your medical history. Treatment decisions today heavily rely on understanding the biological characteristics of a tumor through biomarker and molecular testing. These unique biological findings essentially reveal if an individualized approach, like targeted therapies or immunotherapies, is clinically appropriate for you. For instance, the biomarker testing used for advanced lung cancer is totally different from the testing used for colorectal or melanoma malignancies. This is precision oncology in action.
And based entirely on that meticulous review, several possible treatment pathways might be combined to control the disease, reduce symptoms, and maintain function. Depending on your specific molecular profile and metastatic pattern, your pathway might involve traditional chemotherapy, highly specific targeted therapy, or immunotherapy. It could also involve radiation therapy, local treatments of specific metastases, or even interventional oncology.
Now, let's move on to how these incredibly complex interventions are actually decided upon in the real world.
Before we get into the who, there's a vital point we need to understand about the what. Stage 4 does not automatically mean surgery is impossible. I know that's what a lot of people think, but it's actually highly selective. Surgery can still be possible, but it's only considered in carefully selected cases depending on your exact cancer type, the location and number of metastases, your response to previous treatments, and your general physical condition. For example, in selected cases with limited liver or lung metastases, sometimes called oligometastatic disease, surgery or ablation might actually be evaluated alongside systemic therapy. But here's the thing, no single doctor makes that call alone. For complex, advanced cases, German academic hospitals utilize what's known as a tumor board for multidisciplinary review. Imagine this. All of these relevant specialists, medical oncologists, surgeons, radiation oncologists, radiologists, specialized pathologists, and nuclear medicine experts, sitting together to review your specific case at the exact same time. This guarantees that every possible perspective is reflected in your final treatment plan, guiding your care through collective, high-level expertise rather than just one isolated opinion. Because of how specific these tumor boards and treatments are, please remember this foundational philosophy.
treatment first, hospital selection second. The exact medical treatment strategy required for your unique biology absolutely must dictate the specialist you see, never the other way around. You don't just go out and find a famous hospital. You need to find the specific department with documented, verifiable experience in your precise clinical situation. So if you are looking internationally and considering this level of care, let's break down the exact logistical pathway to seeking a medical answer in Germany.
Often, this entire journey begins with a second opinion. But when is that actually useful? Well, a second medical opinion is highly valuable during cancer progression, when you're facing major treatment decisions, if a previous treatment has failed, or if you are receiving conflicting recommendations at home. It's an independent specialist review of your diagnosis before you commit to traveling abroad. However, we must be absolutely clear here. A second opinion never guarantees that another treatment will be available or that a cure is promised. What it does provide is clarity and an expert perspective. To even start this process, you have to meticulously prepare your medical documents for an individualized review. And I mean meticulously. You can't just send over a brief summary. The specialists in Germany need to see the actual pathology reports, the recent imaging reports, along with the original imaging files themselves, your latest medical report, a detailed history of your previous treatments, recent lab results, and crucially, those molecular or biomarker results we talked about earlier. Having a well-prepared medical file substantially speeds up the entire review process.
Once those documents are ready, you need to follow this exact pathway. Step 1. Submit your medical file. Step 2. A specialist review occurs. Step 3. A treatment strategy is formulated. Step 4. Hospital selection is made directly on that strategy. And finally, Step 5. Travel arrangements are made. International patients should ideally have their medical case fully reviewed by a specialist before choosing a hospital or booking any travel. Traveling internationally before confirming that a medically relevant pathway actually exists, that can just create unnecessary cost, delay, and extreme stress.
And as we talk about this pathway, we have to be completely transparent. Good medical guidance also means knowing when a treatment is not appropriate. A responsible, objective medical review by these specialists may unfortunately determine that traveling for a specific treatment is simply not medically appropriate for a patient's current physical condition or disease progression. Honest, realistic evaluation is a hallmark of premium medical care.
Let's conclude by discussing how you actually access this level of physician-led coordination without getting lost in the system.
This brings us to Euromedical expertise. They coordinate medical treatment in Germany and Switzerland, and what really sets them apart is their foundational approach. They are led by Dr. Hind Helali, a German board-certified specialist physician. Euromedical expertise is emphatically not a booking agency. You see, a standard booking agency typically connects a patient with a hospital based on general availability. But Euromedical expertise uses a physician-led model, meaning a doctor personally reviews your complex medical file first to fully understand the clinical reality, and only then matches you with the specific academic research chairs or specialist equipped to handle your exact diagnosis.
If you or a loved one are considering treatment or a second medical opinion in Germany for advanced cancer, take the next empowered step. Don't base your medical decisions on general assumptions. Base them on your actual clinical situation. Prepare your medical file and reach out for an individualized physician-led review by visiting euromedicalexpertise.com. It really begs the ultimate question. When facing a diagnosis as complex as stage 4 cancer, shouldn't your very first step be guided by a physician who truly understands the science of what comes next? Thank you so much for joining us for this explainer, and we'll see you next time.